Hey everyone, welcome back. When I was in nursing school, hepatitis always felt like this giant, scary topic.
Oh, yeah.
So many types,
Yeah.
so many ways it can spread,
Right.
and the complications, yikes.
Yeah.
But trust me, once you break it down, it's totally manageable. And that's exactly what we're going to do today.
Absolutely. We're going to dive deep into the world of hepatitis, focusing on what's most important for you as future nurses. We'll unpack the different types, how they spread, what to look for in your patients, and, of course, how to provide excellent care.
Okay, so first things first, let's define hepatitis. I always said it was just a viral infection,
Uh-huh.
but our sources suggest it's a bit more complex than that.
Right, it's not always about a virus. Hepatitis is actually a general term for inflammation of the liver. While viruses like hepatitis A, B, and C are common culprits, you can also have hepatitis caused by things like alcohol abuse, certain medications, or even your own immune system attacking the liver.
Wow, I didn't realize there were so many potential causes.
Mm.
But for our nursing students out there,
Mm.
it seems like Hep B and C are the ones to
Yeah.
really focus on.
Definitely. Hepatitis B and C are the most common causes of chronic hepatitis, which can lead to some serious long-term problems like cirrhosis and liver cancer. Plus, they're the types you're most likely to encounter in a clinical setting and be tested on in your exams.
Got it. So let's talk about transmission. I remember learning a mnemonic back in school
Okay.
to help keep the different types straight.
Okay.
A, anus to mouth. B, C, blood cultures and sex.
Yeah.
E, coli water.
Oh, wow.
Does that still hold up?
It absolutely does. It's a great way to remember the main transmission routes for each type. Hepatitis A, true to the mnemonic, spreads through the fecal-oral route. This means it's often linked to contaminated food or water,
All right.
especially in areas with poor sanitation. So,
Yeah. Hand washing is your superpower.
superhero nurses assembling in Word Loveny.
Right.
But what about Hep B and C? They're different, right?
Right.
Hepatitis B and C are bloodborne viruses. This means they spread through contact with infected blood or other body fluids.
And the sources mention some really specific examples that are relevant to our nursing students.
Yeah.
Things like IV drug use, accidental needle sticks,
Mm-hmm.
sharing razors or toothbrushes, and unprotected sex can all transmit these viruses.
Exactly. And it's not just about knowing how these viruses spread. It's about applying that knowledge to protect yourselves and educate your patients. For example, if you're working with a patient who has Hep C, you need to be extra cautious with needles and other sharps. And you need to make sure they understand how to prevent transmission to others.
Okay. So we covered types and transmission now. How about recognizing hepatitis in a patient? I remember feeling overwhelmed by all the signs and symptoms.
Yeah.
Where do we even begin?
Well, some early symptoms of hepatitis
Yeah.
can be pretty general things like fatigue, loss of appetite, nausea,
Yeah.
and vomiting. You might even see fever and muscle aches. Sound familiar?
Yeah, those are like the common cold symptoms we all get from time to time.
Oh.
So how do we know it's hepatitis
Yeah.
and not just a bug going around?
That's where the liver-specific signs and symptoms come in, and those are the ones you really need to know as nurses. One of the key things to look for is jaundice, that yellowing of the skin and whites of the eyes. It happens because the damaged liver can't process bilirubin properly, and it builds up in the blood.
Right. And speaking of bilirubin, our sources also mention dark urine and clay-colored stools
Yeah.
as being telltale signs of hepatitis. It all seems connected.
It absolutely is. The liver normally helps break down bilirubin so it can be excreted. But when the liver is inflamed, bilirubin builds up, causing those changes in urine and stool color. You might also see intense itching, called pruritus, due to the bilirubin buildup.
And then there are the blood tests. Our sources emphasize the importance of checking liver enzymes, specifically ALT and AST. Can you break those down for our listeners?
Yeah, absolutely. ALT and AST are enzymes that are normally found inside liver cells. But when the liver is damaged, these enzymes leak out into the bloodstream. So elevated ALT and AST levels are a strong indicator of liver injury.
So it's not just that these enzymes are present,
Yeah.
it's that their levels are abnormally high.
Exactly. It's all about looking for those patterns and connecting the dots. And let's not forget about some of the other potential findings, like prolonged clotting times, which can increase the risk of bruising and bleeding.
Right. And our sources mentioned that low albumin levels can lead to edema or swelling.
That's a great question. Albumin is a protein made by the liver that helps keep fluid in our blood vessels. When the liver is damaged, it can't produce enough albumin. This causes fluid to leak out of the blood vessels and into the tissues, leading to swelling, especially in the legs and feet.
Okay, so putting it all together, we're looking for those
Yeah.
flu-like symptoms plus jaundice,
Right.
dark urine, clay-colored stools,
Itching.
and then lab results showing elevated liver enzymes, prolonged clotting times, and possibly low albumin.
Exactly. It's a whole body assessment, paying close attention to those specific signs of liver dysfunction. And that brings us to nursing care. How do we actually care for patients with hepatitis? What are the priorities?
Well, one scenario that comes up a lot in our sources
Yeah.
is a patient with constant itching. It sounds miserable.
Oh, yeah.
What can we do for them?
Itching can be really debilitating for these patients. Cool compresses and moisturizing lotions can provide some relief. Avoiding hot showers or baths can also help. And it's important to encourage them to keep their nails short and clean to prevent skin breakdown from scratching.
Makes sense. And I noticed our sources also emphasize the importance of rest.
Yeah.
Why is that so crucial for hepatitis patients?
Rest is essential because it allows the liver to focus its energy on healing. Think of it like giving your liver a timeout so it can recover. It's also important to encourage small, frequent meals, especially during the acute phase when nausea and loss of appetite are common.
I see our sources recommend a low-protein,
Yep.
low-fat diet. Why is that?
The liver plays a big role in metabolizing protein and fat. When it's inflamed, it can have trouble processing these nutrients. A low-protein, low-fat diet makes it easier for the liver to do its job and can help manage symptoms like nausea and vomiting.
Okay, so rest, small meals,
Yeah.
low-protein, low-fat diet. Got it. What else?
Patient education is huge. We need to empower our patients to protect themselves and others. This means talking about safe sex practices, not sharing needles or personal items like razors and toothbrushes, and getting vaccinated against hepatitis A and B if they haven't already.
All super important points. Now, let's talk treatments. I know there are medications for hepatitis B and C, but our sources seem to differentiate based on the type of hepatitis and whether it's acute or chronic.
You're right. It's not one size fits all. For acute hepatitis A, the focus is usually on supportive care, rest, fluids, and managing symptoms. It often resolves on its own. But for chronic hepatitis B and C, we need to bring in the big guns, antiviral medications.
Okay, this is where it gets a little complicated. One source has a whole list of medications for chronic hepatitis B, and I have to admit, it's making my head spin a little.
I hear you. There are a lot of options, but don't worry. We'll break it down. For chronic Hep B, the mainstays of treatment are nucleoside and nucleotide analogs. These medications work by interfering with the virus's ability to replicate. Some common examples you'll see are lamivudine, adefovir, entecavir, tibavudine, and tenofovir.
Wow, that's a lot of ivudines and isfavirs. Any tips for remembering all those names?
Honestly, the best way is to understand how these medications work. Think of them like tiny wrenches that jam up the virus's machinery. You also want to be familiar with a medication called interferon, which can be used for both Hep B and C. It works by boosting the body's immune response to the virus.
So it's like calling in reinforcements for the immune system.
Exactly. And then we have ribavirin, which is another antiviral medication, often used in combination with other drugs.
Okay, that covers Hep B. What about Hep C? Are the medications similar?
Hep C treatment has actually undergone a revolution in recent years. While interferon used to be the standard of care, it had a lot of side effects. Now, we have newer medications called direct-acting antivirals, or DAAs.
Oh, DAs are like the new kids on the block.
Exactly. These medications are much more effective and have fewer side effects than interferon. They work by directly targeting specific proteins the virus needs to replicate. Some common DAAs you might encounter include sofosbuvir, velpatasvir, and glecaprevir, often used in combination with ribavirin.
Okay, so interferon is out, DAAs are in. Good to know. Before we wrap up this part of our deep dive, let's touch on prevention. Our sources really emphasize the importance of vaccination.
Vaccines are our best defense against hepatitis A and B. They're incredibly effective at preventing infection, unfortunately. There's no vaccine for Hep C yet, so prevention really hinges on avoiding those risky behaviors we talked about earlier.
Right, things like sharing needles, unprotected sex, and getting tattoos or piercings from unlicensed facilities.
Exactly. And it's important to remember that anyone can get hepatitis, but some groups are at higher risk. These include people who inject drugs, men who have sex with men, healthcare workers, and people who travel to certain parts of the world.
So prevention is really a two-pronged approach. Vaccination for Hep A and B, and risk reduction for all types. We've covered a ton of ground here.
We have.
From types and transmission to symptoms, nursing care, and treatments. What's next on our agenda?
Now that we've laid the foundation, we're going to explore some of the potential complications of hepatitis. It's a bit heavier topic, but it's crucial for you to understand the long-term impact of these infections. Stay tuned. Welcome back.
Before we move on to complications, there's one more thing I want to touch on about Hep C treatment.
Okay.
You mentioned that DAAs are the new go-to medications,
Yeah.
and that's true.
Right.
But they can be expensive.
Oh, that's right. I remember reading in one of the sources that cost can be a barrier for some patients.
Absolutely.
What's being done to address that? Well, there's been a lot of advocacy around making these medications more accessible. Some pharmaceutical companies have patient assistance programs to help cover the costs. And there are also groups that work to negotiate lower prices. It's definitely something to be aware of as a nurse, because you might have patients who need help navigating those resources.
That's a really good point. It's not just about knowing the medications. It's about understanding the real-world challenges your patients might face in accessing them.
Right.
Okay, so now let's shift gears to those complications we were talking about. I know chronic hepatitis can lead to some pretty serious problems down the road.
Absolutely. When we talk about complications of hepatitis, we're mainly talking about the long-term effects of chronic inflammation. Think of it like a smoldering fire in the liver. Over time, that inflammation can lead to scarring, which is what we call cirrhosis.
Okay. Cirrhosis, that's one of those terms I've heard a lot,
Yeah.
but I'm not sure I fully understand what it means for the liver, what's actually happening.
Basically, cirrhosis is when a healthy liver tissue is replaced by scar tissue. The scar tissue disrupts the liver's normal structure and function. Imagine a smooth, efficient factory turning into a jumbled mess of tangled wires and broken machinery.
So the liver can't do its job properly anymore.
Exactly. And that can lead to a whole cascade of problems. One of the most common is portal hypertension.
Okay. Break that down for me. What is portal hypertension, and why does it happen?
The portal vein carries blood from the intestines and spleen to the liver. But when the liver is scarred and hardened due to cirrhosis, it's like trying to force a river through a narrow, rocky channel. The pressure builds up in the portal vein, and that's portal hypertension.
Okay. I'm starting to see the connection here. So this increased pressure in the portal vein, what does that lead to?
All sorts of complications. One of the most serious is ascites, which is a buildup of fluid in the abdomen.
I've seen pictures of that in textbooks. So that's really uncomfortable.
It is. Ascites can cause pain, shortness of breath, and difficulty moving. It can also increase the risk of infection. Another complication of portal hypertension is esophageal varices.
Esophageal varices. Those are the enlarged veins in the esophagus.
Right. Again, normally. Blood flows easily through the liver. But with portal hypertension, blood has to find alternative routes. It can back up into the veins in the esophagus, causing them to bulge and become fragile. These varices can rupture and bleed, which can be life-threatening.
Wow. That sounds really scary.
Yeah.
So we've got ascites, esophageal varices. Any other complications we need to be aware of?
Yes. Cirrhosis can also lead to hepatic encephalopathy.
Encephalopathy.
And
That sounds like it involves the brain.
You're right. Hepatic encephalopathy happens when the liver can't filter toxins from the blood effectively. These toxins build up and can affect brain function, causing confusion, disorientation, personality changes, and even coma. It can be really challenging to manage.
Okay. So we've covered a lot of serious complications here. Cirrhosis, portal hypertension, ascites, esophageal varices, and the hepatic encephalopathy. And there's one more big one we need to discuss, liver cancer.
Yes, unfortunately.
Yeah.
Chronic hepatitis B and C significantly increase the risk of developing hepatocellular carcinoma, the most common type of liver cancer.
So this chronic inflammation
Yeah.
is really setting the stage for some really serious health problems down the road. It makes you realize how important early detection and treatment are.
Absolutely. Catching hepatitis early and managing it effectively can make a huge difference in preventing these complications.
Okay, so we've talked about the bad news, but is there any good news here? Are these complications reversible? And can the liver heal itself?
Well, it depends. In the early stages of liver damage, some of the damage may be reversible if the underlying cause is addressed. For example, if someone stops drinking alcohol, their liver might be able to repair itself to some extent. But once cirrhosis develops, the damage is usually permanent. So the key is to prevent that irreversible damage from happening in the first place. That means early diagnosis, proper treatment, and lifestyle modifications to support liver health.
Exactly. And that's where nurses play such a vital role. You're the ones on the front lines, educating patients, advocating for their needs, and providing compassionate care throughout their journey.
We've covered so much ground today, and I know it's a lot to take in. Before we wrap up, is there anything else you want to emphasize for our nursing students? Any key takeaways they should really remember about hepatitis?
I think the biggest takeaway is that hepatitis is a complex disease with potentially serious consequences. But with knowledge and vigilance, we can make a real difference in the lives of our patients. Remember, you are their advocates, educators, and caregivers. Your role is crucial in preventing transmission, promoting early detection, and supporting them through treatment and beyond. Those are powerful words. I know our listeners are going to walk away from this deep dive feeling empowered and informed. But before we sign off, I want to leave you with one final thought to ponder. We've talked a lot about the physical impact of hepatitis, but I'm wondering about the emotional and social aspects. Having a chronic illness like hepatitis can be really tough on people.
You're absolutely right. It's not just about the physical symptoms. It's about the whole person. Living with chronic hepatitis can be incredibly challenging, emotionally and socially. There's often a lot of fear and stigma associated with these diseases, and people might experience discrimination or isolation.
That makes sense. I imagine it can be difficult to talk to friends and family about it, especially given the way some of these viruses are transmitted.
Exactly, and that's where nurses can play such an important role in providing emotional support and connecting patients with resources. There are support groups, counseling services, and online communities where people can connect with others who understand what they're going through.
It's like that saying, it's okay not to be okay. But it's even better to have someone to talk to about it.
Yeah.
Okay, so we've covered a lot of ground today. But before we wrap up, I want to circle back to something you mentioned earlier about nurses being advocates for their patients. What does that look like in the context of hepatitis care?
Advocacy can take many forms. It could be as simple as making sure your patient understands their diagnosis and treatment plan, or helping them access financial assistance for medications. It could also involve speaking up for them if they're facing discrimination or stigma, sometimes. It's about educating other healthcare providers about hepatitis and dispelling myths or misconceptions.
So it's really about being a voice for your patients and ensuring they have access to the care and resources they need.
Exactly. And it's about treating them with dignity and respect, regardless of how they acquired hepatitis or what their life circumstances are. Remember, everyone deserves compassionate care.
Well said. I think that's a perfect note to end on. To all our nursing students out there, I hope this deep dive has given you a solid foundation in hepatitis. Remember, knowledge is power, and you are now armed with the information you need to provide excellent care to your future patients. Keep learning, keep asking questions, and never stop being curious.
Thanks for joining us. And remember, you've got this.